So a lot of my research work is based on patient outcomes, and that's what I focus on. How can we make quality of life better for our patients? How can we change the care that we're giving our patients and learn from our mistakes so that we all can be better as a community? So specifically, Social Security disability was a good topic because there's a lot of government standards, right, when they're classifying that disability. So that provides a sense of uniformity for these fibromyalgia patients. And why is that important? Is because fibromyalgia is very subjective. No two people are going to have the same symptoms, same disease presentation. So having this fluctuating subjective disease in this Social Security disability, which is a very a hardcore set norm, and seeing how these patients qualify, I thought was going to give us very good results to work with. And this idea originally came from the late Dr. Wolf, and he's the one who actually set the ACR criteria for fibromyalgia in the first place. And he did this study back in 2014. His entire purpose of doing this study was seeing the patients who get classified as fibromyalgia, do they truly have positive criteria? And if they do they qualify for disability? And he compared this with patients who have rheumatoid arthritis or osteoarthritis. And we did the same thing again. So the reason why we repeated this exact same study after a decade is that there's been a lot of growth in understanding fibromyalgia. This category of disorders is called centralized pain processing disorders, where patients perceive pain differently. Okay, initially back in the days, it would be, brushed to the side or not considered a real disease, but now it is. And we wanted to see, does this translate into higher disability approval rates for these patients? And the second thing is that the ACR criteria for fibromyalgia, those got modified in 2016. And now it's more comprehensive in terms of fibromyalgia is not a diagnosis of exclusion anymore. Anybody can have fibromyalgia as long as they fulfill criteria, and it's okay if they have other diseases that can cause them pain. So these two things together allow us to diagnose patients more, and again, society's perceptions have changed, so it allows these patients to get disability benefits more, which is what my study looks at. So we did see that all the patients in fibromyalgia category and rheumatoid and osteoarthritis category who fulfilled the criteria had higher rates of approval for Social Security disability, which is great. But then we also saw that a lot of patients who have RA and OA concomitantly did get much higher rates of approval compared to patients who had fibromyalgia alone. That being said, the next leg of my study is going to look at whether these patients with RA-OA were in fact more disabled. Is that the reason? Or was there a bias that was playing a role here? In the second part, what we look at is the predictors for the fibromyalgia patients getting disability benefits. And we saw the strongest predictor was functional status predictor. It's called the Euro-Qual-Fi score, which is basically Euro for Europe, Qual is quality of life, and 5 because it has 5 questions. These are very basic questions, how a day-to-day activity-based question, how a person can function or not. And this is the strongest predictor. And that says a lot itself, right? If the patients have higher scores for Euro-Qual-Fi, which means they're not able to do day-to-day activities, that in turn should qualify them for disability benefits. Other predictors that we saw were pretty high up there were pain VAS scores, mood scores, and also comorbidity index. Because patients who had higher comorbidities, be it heart disease, liver disease, lung disease, along with fibromyalgia, did have much higher rates of approval. So if there were 2 takeaway points from my study, the first would be that we should look at fibromyalgia more as a trait diagnosis rather than a state diagnosis. A state diagnosis is, does a patient have this? Yes or no. A trait diagnosis is something that a patient has, but it doesn't always have to show. right? And we associate trait diagnosis more with continuous variables rather than categorical variables. So let me elaborate on this. Categorical variables, most diseases are categorical, right? It's a yes or no. Does the patient have a disease or not? But what we're seeing time and again with fibromyalgia is that a lot of it is defined on a continuous variable scale, say by the PSD score, polysymptomatic distress scale score, which is from 0 to 31. And at some point, patient can be at score 2, which can go up to score 8 if they have social stressors or anything else going on in life, which can go up to score 20, and they might drop back again. So I do want that to be emphasized in practice. And regarding research, I do think there's some stuff about fibromyalgia, but a lot of fibromyalgia patients get seen and treated by their primary care physician. So what would be beneficial is some kind of collaboration between PCPs and rheumatologists, where we all can come up with, more treatment discussions, more diagnosis discussions, and more collaborative discussions so that our patients get better comprehensive care. I do think there's a lot more work to do. Our study is an observational study, so it just looks at data as it is. The next leg of our study is gonna be focused on looking at employment indices, because we also want to see what kind of work did the patient do before, what kind of satisfaction scores did they have in their work. And work also has been seen to have significant impact on a person's mood, and mood has significant impact on their fibromyalgia or autoimmune disease. So is there a correlation coming from that angle? So we want to explore those themes. And again, another thing that we're kind of looking at is looking at these functional status indices, be it HAQ or the Euroqual, and compared across different diseases, be it RA, osteoarthritis, lupus, vasculitis, and fibromyalgia, and truly see what the functional status for these patients is across different diseases.